You're listening to The Drive Home.
Alrighty, guys, it's 4:30 on The Drive Home on your Monday. Wayne and Tanya here.
Yes,
Bride's
we
on
are.
vacation.
Yeah, I know.
Enjoy some vacay for the week.
Yeah.
And he was nice enough to send us drive time trivia.
Oh,
Which I thought was awesome.
Yeah, I haven't really actually looked at the question, but that was very nice of him.
And I will admit, I'm totally unprepared for our discussion here at 4:30 with our friends from St. Anthony Memorial Hospital, because we've been sitting here talking about vacation in Florida.
Really? Yeah. Well, how's that been going?
Yeah. And so we have
Sara Geen.
Sarah. What was your name again?
Sara Geen.
Okay. And Sarah, what do you do at the hospital?
So I am a physical therapist at HSHS St. Anthony Hospital and at the Workman Sports Complex here in Effingham.
Very good. And Tammy joins us as well, right?
I am joining.
How are you?
I'm good.
Very good.
All right.
So, Sarah, you at the Workman Sports Complex again.
Mm-hmm.
And so, Tanya, go ahead. I'm sorry.
Oh, well, I know you're going to be talking about balance and how to prevent falls. So outside of the obvious, how do we keep from doing that?
So when you're looking at falls or fall prevention, there's 3 systems that kind of make up how we keep our balance. So we have somatosensory, which is a sensation on the bottom of your feet, and your joints have receptors in them that kind of tell our body where your joint is, if it's bent or straight. So if you're diabetic, you don't have that sensation on the bottom of your feet, so that can affect your balance. You also have your vision that helps keep your balance. So you will see a lot of times people fall more often when it's dark or when they're in busy environments and they're distracted, so they can have more falls that way as well. And then you have your vestibular system, which is your inner ear, and the inner ear tells our body where we're at in space. So if we're leaning forwards, if we're leaning backwards, how fast we're moving, if we go faster or slower. So all 3 of those systems help a person maintain their balance. And when one of them isn't working very well, then that's where that fall risk comes in, and people are wanting to hold on to furniture when they're walking inside their house, or they need a walker or a cane to help them with their balance. They start decreasing their activity level because they don't feel steady on their feet.
So all of these systems need to be functioning together like they're supposed to be in order for our equilibrium to be right, correct?
Correct.
All right. So what will physical therapy do to address that problem?
So when you come in for that physical therapy evaluation, we're going to look at what your walking pattern looks like, how fast you're walking, do you shuffle your feet, do you have a nice step length, or are you taking really short steps? We're going to do a couple balance assessments. So we're going to look at can you lean forward or lean backwards? Can you turn and look over your shoulder? When you turn around, say around a corner, do you keep your balance, or do we have a loss of balance again? We'll also look at your strength, so how strong you are kind of in your trunk, in your back, and your stomach muscles, how strong your hips, your knees, and your ankles are as far as the muscles go there. Do you have any restrictions with range of motion? So maybe your knee doesn't bend like it should, or your ankle doesn't bend like it should, so that's going to change your walking pattern. And then if we need to, we can do an assessment of your vestibular system. So we'll do an eye exam and place you possibly in different positions to see if there's something going on with the inner ear that's causing that balance. We'll also look at when you're standing, what your base of support looks like. Do you keep your feet, shoulder width apart, or do you stand with your feet too close together? When you're standing, are you leaning too far forwards? Are you leaning too far backwards to where, if you're leaning backwards already when you're standing, if something pushes you backwards, you're going to either take a fall or you're going to have to take a step to prevent yourself from falling.
Gotcha. Okay.
Oh, wow.
All right.
Okay.
In what we have here in our email system, so I did not realize Menieres Disease had something to do with this as well.
Right. So if we're looking at the vestibular system, it's made up of 3 semicircular canals in each ear that are filled with fluid, and then you have 2 otolith organs in your inner ear that are going to detect how fast you're moving or where you are at in space.
The organs you just said again were what?
So they're otolith organs. They're two organs that
Never heard of that.
Yeah, they have two. The organs have calcium carbonate crystals in them. So those crystals move when you move your head, and that keeps our body in space.
I had no idea.
Yeah.
Wow.
Most people don't know about it unless they are out of place, and then you are dizzy when you move your head.
Okay.
So yeah.
Oh, all right.
I had no idea.
But if we're looking at Menieres disease, what happens with that is the composition of the fluid in your inner ear has an excess amount of sodium. So that can be affected with your diet. So you either have excess sodium, you're drinking too much caffeine, and if you have the Menieres disease, those type of things that you have in your diet are going to cause an attack to where any sort of movement you go into is going to feel like you're still moving. Most people, when they have an attack, the attack is going to last more than 20 minutes, but less than a day. They like to just lay in bed with a door closed, the lights out, just to try to get over that attack. What therapy is going to do is kind of teach them the proper diet so they can reduce the number of those attacks and then try and improve their balance with that.
Now, when you say too much caffeine, what are we talking too much? Because as soon as you said that, I'm like, I drink a lot of coffee.
Yeah.
Yes, I do.
I know.
So typically just, if you don't have the Menieres disease, just drinking a lot of caffeine isn't going to cause you to have the dizziness. But if you have the diagnosis of the Menieres, I'd say probably more than 2 cups of coffee is going to could possibly set you off.
No kidding.
Really?
That's not much at all.
I had 2 8-ounce glasses, correct? Because I could probably do one huge cup, but that's not what you're talking. You're talking 8 ounces, right?
Yeah,
Okay.
right.
Wow.
Yeah.
So now, how can therapy improve the balance with the neuritis and did I say that right?
Yep. So
and Menieres.
So the vestibular neuritis is I'd probably say the second most common cause of patients having dizziness. So what the vestibular neuritis is you can have a virus or an infection cause inflammation around that vestibular nerve in your ear. And when that happens, you have a mismatch of information from one ear to the other of your information going to the brain. So those infections can be caused by, a sinus infection or, a common cold. I've seen several patients that have had COVID that have come in for dizziness because that infection from the COVID has caused just really bad motion sensitivity. They can't go to the grocery store. They can't ride in a car. They don't like to watch TV just because that fast movement causes problems with their vision.
Oh, that's not good.
No.
So what therapy can do for patients who have had, vestibular neuritis from an infection is we will do an eye exam to see what their eyes show with the testing. And a lot of times they have a hard time focusing on objects when they're moving their head. So things get really blurry, and then they stop moving the head just to avoid the dizziness. So therapy works on some eye and head exercises to improve that ability to focus and improve that gaze stabilization. And then we can also work on different activities to reduce that motion sensitivity. So say they have problems laying down and sitting back up or bending over to put their shoes on. They just feel like their body's still moving. So we find what activities or functions they do that cause that dizziness, and then we do those movements repeatedly to reduce that sensitivity and allow them to return to their normal activity.
Is this something that's pretty common? I mean, are a lot of people affected by this?
I would say I see on average for patients with dizziness maybe 2 to 3 patients a day. So over the course of a week, I may have about 10 different patients that come in for dizziness.
Really? Now, if someone, has, or they want like a balance and evaluation, or maybe they are dizzy, who can they contact?
So they can speak with their primary care provider or a nurse practitioner that they see on a regular basis and obtain an order for physical therapy. And we have two therapists that are trained specifically with the vestibular diagnoses and complaints of dizziness that can do an exceptional job in treating patients with the dizziness.
Awesome.
Okay. Wow.
Very good. So
I had no idea.
I did not either. I didn't either.
Most patients I see that come in for dizziness say, "Oh, I didn't even know therapy could help this." So they leave after that first visit with a lot of information and typically feeling a lot better.
Yeah,
That's great.
it's good to know that there's something that they can do.
Yes.
That a lot of people probably feel like they're stricken with it and they're stuck with it forever. It's good to know they can do something, and it's great to know that St. Anthony Memorial Hospital can do it for them. That's awesome.
Yes.
Yes.
Again, if they want to contact you and get started, what should they do?
So again, they just need an order from their doctor, and
Okay.
they can reach us at the Richard E. Workman Sports Complex with the St. Anthony Outpatient Therapy at 217-347-1243.
That's awesome. And
Right.
question real quick for Tammy.
Yes.
Where do you guys put all these people at the Workman Complex? Because I'm like, everybody we talk to is at the Workman Sports Complex.
Well,
It's like, it's a huge place, but man,
I'm glad you asked me that question because I do have a little tidbit of information.
really awesome.
So, just in therapy, in physical therapy alone, we have 10 physical therapists and we have 8 physical therapy assistants. And between those 18 people, we have 178 years of therapy at St. Anthony's Hospital.
Wow.
Wow.
So now that's not experience because they might have been in another position before they came to see us,
Huh.
before they were employed with us. But just working at St. Anthony's was 178 years between 18 people.
That's awesome.
Okay.
So think of all of the experience and the collaboration that we have amongst each other. So
Absolutely awesome. Yeah, very, very good.
yes, we fit them all into one building. So one
Which
little
is
space.
nuts.
They're not all there at the same time.
Okay. All right.
Very good. All right. As always, guys, thanks for coming in. Sarah, Tammy, very good. And to get more information, of course, if you go to, help me out with the website again.
It is www.stanthonyshospital.org.
Very good.
All right.
All righty. Greg Sapp is in with local and area news just after Fox at the top of the hour, and more of the drive home coming as well. Stick around. As well.